Good afternoon, I'm Starshay Richardson, and this is my intervention for Jane Doe. So, Jane Doe is my current patient. She recently went to her healthcare provider and was diagnosed with stage 2 breast cancer. So I want to use the care management model for her intervention, and with this, she'll be working with multiple caregivers to ensure both her mental and physical health are intact. Her team will be able to provide her information on breast cancer itself. They'll provide emotional support. They'll help the patient to make appointments, accessing financial assistance, and advocating for herself. They'll also discuss the financial, psychological, and practical barriers that she might run into. So currently her physical symptoms include poor appetite, physical discomfort, sleep disturbance, energy loss, reduced concentration, and feelings of guilt relating to her inability to carry out her responsibilities at home and at work. Right now her current source of stress relief is smoking. So we'll start with her having her social and medical history, providing some key points, starting with the fact that she is age 65. She's an African American woman. She's married in a monogamous relationship. She has 2 children, a son who's about 40 and a daughter who's about 38. She's in her 4th year of retirement. She has a pet dog. She's been smoking since she was about 16, meaning she's been smoking for 49 years. She denies alcohol or any illicit drug use. She has a history of hypertension, and she smokes about 2 packs a day. She also has a family history of breast cancer. Both her mother and grandmother have passed away from breast cancer in their late 60s. There have been no reports of any medicine, food, or environmental allergies. I'd like to start her off with a mental health status exam, which will be conducted through the PH9. The PHQ9 is just a questionnaire which is self-administered. She'll be screening for the severity of her depression symptoms. The test consists of a series of questions that are scaled from 0 to 3. 0 is not at all, 1 is several days, 2 is more than a week, and 3 is every day. The highest this patient can score is about a 27. Jane scored a 15, which classifies her as somebody who is moderately to severe depression, which is pretty severe right now. So with the consent of the client, of course, and the current data that has been provided, which is her physical exam as well as her PHQ-9 results, we'll start building her a team of caregivers, which will be, and we is Jane, her social worker, myself, and then her primary care doctor. The team will consist of her primary care doctor, a practical nurse, social worker, a dietitian, a pharmacist, and a therapist. Everybody will explain their roles in the patient's recovery plan, and while getting with the other caregivers, we'll all devise a pretty decent schedule for her so she's not too overwhelmed having to meet with people as much. Our biggest challenge right now is getting her to quit smoking. Due to the longevity, it'll be hard for her to just completely quit cold turkey, which we're not expecting because that's unrealistic. So we'll start with her just taking smaller doses. So rather than smoking 2 packs a day, she might go to 1 pack a day, and we're hoping that it'll slowly go down, and we'll try to find some other things that she's interested in to give her healthy options as far as coping skills go. She has had a history of depression, and previous treatments haven't really worked for her, so I'm thinking that maybe if she gets with her physician and they go over some recommendations that her physician has, since she does trust them with their life, it might make it a little more comfortable for her. having somebody that she trusts with her life to help her find somebody to trust her emotions and thoughts with. Her case manager will pretty much be like a field liaison for our patient. She'll advocate for not only her needs but the team members who are providing caregiving as well. So once she gets with this therapist that's been picked out for her, I believe cognitive behavioral therapy would be the best intervention to start with alleviating her depression and anxiety symptoms. Cognitive behavior therapy is made up of situations, thoughts, physical feelings, and actions. The therapy aims to make the client's problem more manageable and improve the way that they feel. I think this therapy will be a little easier for her to try because it's not your typical therapy. You're not just going to have somebody telling you what to do or how to feel. Like, this will be an open discussion between her and her therapist. We'll start her off with about 12 sessions minimum. So she'll have an appointment once a week, 30 minutes to an hour, depending how she's feeling that day, how much she's willing to share or not share. I think it'll be good for her to understand like what triggers her anxiety, what's triggering her depression symptoms, and how she can avoid those triggers as well. And this will also help her communicate with not only the care team but her family and peers. And then as far as her physical health goes, so the client has stage 2 breast cancer in her right breast currently. Luckily, this stage does allow her doctor to tell how big the cancer is and how far it'll spread. So after a physical assessment, typically her and her physician have decided that local therapy would be her best treatment option. Local therapy consists of surgery and then radiation that can treat cancer in the breast while preventing cancer from reoccurring and affecting her surrounding areas. So Jane will have to endure lumpectomy surgery. That way she avoids removing her entire breast, and they'll just remove the cancer and the portion of surrounding tissue that is currently infected. And hopefully this will help her depressed mood decrease, because her biggest fear right now is not making it through her surgery or radiation. Her physician and radiation therapist should typically break down like what a typical session will look like for her, so she's not as anxious during this recovery process. For example, she'll have to endure treatment for 5 days out the week, Monday through Friday, for about 5 to 6 weeks, and the sessions can range between 15 to 45 minutes. And to help ease her mind, the radiation therapist will be able to actually explain like what's going on. They'll be able to monitor and speak to her. They won't physically be in the same room. They'll actually be in another room watching her through a monitor, and they'll have an intercom to communicate with each other. If this at all gets overwhelming for her or it becomes too much, she'll be able to have that conversation with them, just to stop it or to see like what she may be able to do to ease her nerves or make this experience better for her. Overall, I think the care management strategy is a great intervention for her, because when dealing with chronic diseases as well as your mental health deteriorating, it's gonna take a team. One person is not gonna be able to solve this. Just like, obviously it would be a good note to have your doctor help you get rid of the cancer, but you'll still need someone there to help you get through those emotions that you're feeling. A bigger support system, just your peers and family, professionals who are able to explain what is going on and what could be done better to help this client specifically get through her treatment. And I think both the therapy and physical treatment options are great for her. Radiation and lymphotomy surgery are highly recommended for people with stage 2 breast cancer. A lot of women with breast cancer constantly worry having to lose their entire breast. I think the lobotomy is great, so it does not further trigger her depression. They'll simply be able to just remove the toxins that are currently there. And then with the radiation, it will be tiring, I will say, from firsthand experience, but she'll be able to slowly feel more like herself in the end. Her mental and physical health we'll both be in good hands because she'll have an array of support as well as people there to explain the entire process for her and what's going on and what she can do and what she can't do.